Hello and welcome. My name is Joey, and this is the final video of the series called 7 Simple Tips to Help Relieve Your Back-Related Issues. This is tip number 7, where we dive into the therapy versus surgery debate. Now, this is more of an informational, knowledge-based video that's not really meant to sway you one way or another, but really give you the tools to understand there's different options out there. So what will you get from this video? Of course, how to decide if you are a good rehab candidate, how to decide if you are a good surgery candidate, and how to choose the best therapist, and of course, how to choose the best surgeon and surgery approach. We're going to talk about why this is important because let's face it, there's a lot of false statements and misinformation out there. Plain and simple, the internet is bogged down with a bunch of that. So choosing the wrong choice can cause a lifetime of regret and complications from surgery. Of course, those are very evident, but also how you approach your rehab and who you do your rehab with is super important. Knowledge is power, and your health is important. So put the power into your health and into the knowledge that you're going to obtain. So long-term effects are real and can add up over time. This is super important to make that decision count. Here's how this video will help you specifically. You'll learn the importance of therapy so you can avoid the knife if that's your option. Understand there are affordable options so you can make the best financial decision when it comes to your health, not only about your health, but also your finances. And understand that you have choices so you can avoid long-term consequences like we talked about. So you may, you may regret those later. But let's talk about therapy a little bit more. Therapy types and how to choose. Now, these 4 that we're going to talk about are basically categorized under short-term rehabilitation services. We're going to talk about physical therapy. We're going to talk about chiropractic, massage therapy, and personal training. Even though personal training isn't a true therapy type, there's a lot to be found in those benefits. So there's many forms of therapies out there and many modalities in these forms as well. Physical therapy focuses primarily on soft tissue rehab and recovery. There's post-surgical, there's stroke, occupational, and injury pain related. Now, physical therapy is really into the light of working a lot with the medical field, and in fact, there are DPT programs, it stands for Doctors of Physical Therapy. They usually focus on non-surgical, non-pharmacy approach to care, and there's care planning and goal setting, and typically they have insurance coverage, so it makes it a little bit more affordable, but you have to have a true diagnosis, a true issue going on, and there is a referral in most states required that a medical doctor send you to a physical therapist. These are highly trained, skilled professionals that are really going to address the problems, give you the tools, and teach you how to go down the path of correction. Now, chiropractic care is focused on the spine and joint-related issues primarily. They use a lot of x-rays for diagnosis and diagnostic purposes, and that doesn't always have to be the case, but there's a heavy emphasis more and more in the chiropractic community on rehab. So you kind of get a mixture of the alignment, bone, joint, and muscle found in physical therapy, but they specialize in neck, back, headache, and disc-related issues, a lot of disc bulging, sciatic type issues. And they are doctors of chiropractic. You'll see DC as representation a lot of times. They are non-surgical, non-pharmacy. They have care planning and goal setting and insurance coverage in most all states and most all plans. The other side of that is they don't require referral in pretty much all states. There are primary gatekeepers in health, and they don't require referral from a primary care physician, someone that is very dedicated to the bone and alignment and biomechanical function of the spine and other joints for long-term longevity and health, because they really focus on the nervous system as a source of controlling all things, which is the truth, because the nerve, of course, communicates to the rest of the body, and if there's any type of interference with that nervous system, it can cause interference to that joint, to that muscle, to that tendon, to even organs. They found some relationship to nerves infiltrating, of course, organs, but if there's an interruption to that communication by bone or spinal misalignment, there can cause some interruption. So that's what they focus on. Moving into massage therapy, it is gaining more and more popularity with increased research and acceptance from the medical community. They are better trained than ever. They are nationally licensed. They're providers in the healthcare world, and they're trained on treating more and more conditions that are medical based, everything from anxiety to fibromyalgia to sports injuries, you name it. They are non-surgical, of course. They are non-pharmacy, and they can have insurance coverage. A lot of people don't understand that there is that relationship, even with health savings accounts and things like that. And especially if they are medically overseen and directed, there is a relationship, and most have insurance coverage available as well. Surgical clinics, pain management clinics, physical medicine, and those types of clinics, and even chemotherapy centers are employing more massage therapy and more massage therapists to perform and treat their patients because of the trust and understanding and benefit from these therapists and massage modalities. So something that's really beneficial for relieving aches and pains, lower back, soft tissue relationship. Personal trainers, they're really for muscle stability, strength building, endurance, mobility in general, and weight loss is a big focus of theirs. They're certified and often highly trained in the same techniques that physical therapists learn. The biggest thing for them is the accountability part. You have a trainer, you have a coach, you have someone that's going to hold you accountable to show up for your sessions, or be there to gain and motivate and improve you. They're very big on goal setting and planning. Of course, they're non-surgical, non-pharmacy, but it's still not considered a professional option in most cases, and the out-of-pocket costs can add up because there is no type of insurance coverage necessarily on that level. So let's break it down just a real quick way. So think physical therapy, injury relief using different modalities, everything from strapping, taping, kinesiology tape, to using different tools, modalities, ultrasound, TENS unit, and then bands and ball work to build strength and really rehab and heal certain areas. So think relief using modalities specifically around injuries. Chiropractic, think spine, joint alignment, and rehab techniques. So very focused on the spine and the nerves that come out of it, going down to different joints, any union of a bone to bone, and helping with that alignment and biomechanics, and using rehab techniques for alignment and muscle work. Think massage therapy, manual muscle work, and release techniques. More and more stretching, more and more releasing of tension and trigger points and knots. That's very specific to getting overall longevity and health, but also muscle recovery from the postural aches and pains that we get that are very non-specific as injuries per se, but are aches and pains that build up over time. Massage therapists handle this excellently, and you can usually get a lot of immediate relief and then long-term benefits as well. Personal training, think muscle improvement, strength building, and weight loss. They're very big on, of course, weights, moving with coordination, and also functional improvements from everyday lifting and moving. You want to build your strength and endurance in these muscles to avoid injury. But if you're feeling these aches and pains, it has to do with some type of muscle fatigue or muscle imbalance. So they help with those improvements. So those are the major 4 therapy options that are accepted in most societies. Let's go on to surgery. Now surgery, I don't want to harp too much on this, but it's usually the last resort, but doesn't always have to be the first. Somewhere along the line, it's caused a major disruption in lifestyle, in movement, and it's causing a major detriment to your overall well-being. So surgery, really with the spine, may develop in different methods, and you're looking for different types of offering, different types of relief, and you're at this point. Your doctor may recommend surgery. So the 3 major ones that we're going to talk about that are usually the go-tos for most spinal surgeons is the first one is spinal fusion. This is the most common surgery for back pain. When someone is suffering from back pain, it's typically triggered when the joint is in motion. So during a spinal fusion procedure, the surgeon will fuse the bones of the spine or vertebrae together to stop movement from occurring. When the vertebrae are fused, the joint can't be moved, so the pain is alleviated. That's the overall idea. And as you can see to the right, this is something I'm going to be referencing, but the 2 pieces of bone, you can see kind of the tan color, are separated by a disc. The little stringy pieces out to the side are nerves, and at the center is the spinal cord. And what they would actually do is fuse those bones together so it doesn't cause movement between the bones and the discs there. So that's spinal fusion. Now, typically with spinal fusion, it can lead to more fusions down the way, but it doesn't always have to if it's addressed correctly. A laminectomy is the next one. So during a laminectomy, the surgeon will remove the lamina, which is part of the bone that makes up the vertebrae in the spine. So removing bone spurs or ligaments in the back may also help during this procedure. So they're basically removing pieces of the bone. The removal of these bone spurs or ligaments eliminates pressure on the spinal nerve. In turn, the patient is no longer has to deal with the pain or weaknesses that's been present. In some cases, the removal of a significant portion of the bone is necessary, which can cause instability of the spine. When this happens, a spinal fusion may be the best option as well. This surgery is ideal for patients who are dealing with severe chronic pain or loss of function due to a bone spur. A bone spur is an area, just like it sounds, a spurring of the bone, kind of a sharpening of the bone that's causing interference with a nerve or pain. Results typically last for years, although it's impossible. It's possible the bone spur may return. It's impossible to really know that, but the idea would be to fuse portions of the bone naturally, but by removing portions of the bone. So a laminectomy is removal of certain parts of the vertebrae to relieve nerve pain. A discectomy is portions of the disc that's removed. So the disc is that little soft, spongy piece that sometimes can bulge, as you can see in that far right picture. It's almost bleeding into, or almost fluid is going into and touching on that nerve, causing nerve pain, decreased function, overall inability to sometimes even perform or move. So if you're dealing with a herniated disc, you may be eligible for a discectomy. The disc is the spine, like I talked about, is a shock absorber and provides cushion between the vertebrae. However, when one of these discs slips out of place or bulges and becomes herniated, it can cause and put intense pressure on the spinal nerve and cause back pain. To treat this pain, a surgeon will remove part or all of the disc. Due to the removal of most of the disc, there is a very slight chance that the herniated disc will occur ever again at this location. But again, this is something that you're removing portions, so it's exactly hard to tell. But the idea is getting more and more minimally invasive, less of a bigger surgery ordeal to remove portions of this disc. So that's the way that they would approach it. So what's the overall conclusion? The conclusion is that there are several options out there, plain and simple, from traditional to non-traditional therapies to surgical to non-surgical options. Every few months, it seems like there's more and more advances in medicine and rehab that allow for less invasive, more successful with low-risk options. Explore those. Things like stem cell research, growth factor studies, all that stuff is going on in Europe and is just now starting to begin in the States. So very progressive, very advanced of what we have going on out there. So, explore your options. The ultimate conclusion is that the power is in your hands. So do your research and weigh out the pros and cons in all situations, from cost to risk and everything in between. This concludes our series on the 7 simple tips to relieve your back-related issues. I really hope you enjoyed this series, and thanks again for watching. Hey, before you go, if you enjoyed this content, you would probably benefit from our intro massage package we created for new clients. Just click the Learn More button below to find out more. Thanks again for watching.